It's notable that in the course of talking to people about their shame, their perfectionism came up over and over. It's not surprising, though, when you look at the psychology. So, perfectionism or perfection is the ability to achieve a standard to the highest degree all the time. And shame comes about often when we fail to reach a standard. Then imperfection in any sense of its form can be a shame trigger.
Welcome to Success Reimagined. I am Dr. Amna Shabbir, your host on this journey to thrive at the intersection of ambition and wellness. In every episode, I'll help you challenge outdated definitions of success, discover practical tools and strategies for growth without compromising your well-being. I am so glad you've joined me. Let's reimagine what's possible together. Today, I'm honored to welcome Dr. Will Bynum, a family medicine physician and associate professor at Duke University School of Medicine. Dr. Bynum is the co-founder of the ShameLab, an organization dedicated to understanding and addressing shame in healthcare and beyond, as well as a co-creator of the shamespace, a global consortium fostering open conversations about shame in medicine. His groundbreaking doctoral thesis, Out of the Shadows, a qualitative exploration of shame in medical learners, has been instrumental in advancing our understanding of self-conscious emotions in medical education. Welcome, Dr. Bynum.
Thanks, Anna. Thank you for having me.
I always like to start these conversations with your perception and understanding of what the word perfectionism means. And I know that people will sometimes give me definitions, but if you had to just view it on a more individual level, what does the word perfectionism mean to you?
About perfectionism as being a drive or a commitment to achieving the highest quality of work or highest quality of outcome as consistently as possible. We live in a world of standards all around us, and perfectionism would orient us, or me, if I was a perfectionist, towards achieving, not only achieving a standard, but achieving it the best I possibly could all the time. That would be ultimate perfection. Perfectionism maybe is to me the striving to do that.
To be perfect all the time. That sounds exhausting.
Oh, it's completely exhausting. It's also impossible. That's why when I think about perfectionism, I think about it being more maybe an attempt to achieve perfection, with perfection being the outcome, perfectionism being the work that goes towards that, or maybe even the tendency or the character trait that orients us towards striving to achieve perfection all the time.
Absolutely. So that is one of the very interesting answers that I've heard so far, in which you've effectively broken down perfectionism and the outcome of perfection. Would you consider yourself a perfectionist?
That's a great question. And actually, no, I would not. And calling myself a perfectionist would be too simple to explain how I am when it comes to achievement and standards. I definitely have perfectionist tendencies. I definitely like to strive for perfection when I can. The way I maybe understand my own relationship with perfection is more just that I think I inherently hold myself to high standards. And it's not that I'm necessarily striving to reach those standards because I need to. It's just that that's the type of work that I tend to do. I just hold myself to a high standard for the work I do. And I can fall short of perfection, and that doesn't change the standards, and it doesn't change the fact that I hold myself to them. So it's not so much the outcome that I'm concerned with as it is the commitment to the type of work that I do or want to do. And that's helpful, I think, at times, because it doesn't make failure to achieve perfectionism a failure of the self. It just makes it a natural side effect of holding myself to high standards. They're really complex things. Being a perfectionist is almost a marker of identity. Perfectionism maybe being a character trait. And what we're talking about are things that are about us as people, how we know ourselves, who we're trying to become. And those are really complex. And we're also striving to be those types of people, or to develop those character traits amidst the reality that perfectionism is impossible to consistently achieve. So there's a paradox here, I think, that we exist in. And that's where I think a lot of the complexity of perfectionist tendencies comes into play.
It's definitely complex. And you're an expert on shame, a word that a lot of us don't like to talk about. It just makes everybody very nervous. I've noticed this in circles. I feel that there may be some people that are more accepting of this. other people just look at me when I talk about something like shame. This is something that I've recently commonly heard, and rightfully so, is that shame seems like a primitive and maybe necessary human emotion. So as we transition to talking specifically about shame and shame's complex interplay, I first want to define things because I feel that once we know what we're talking about, then we can talk about it in detail. So how do you define shame, and is there good shame and bad shame?
Yes, a shame. It is a heavy stigmatized topic, and it's often the word itself is hard to say. So it's great that we're talking about it. I just think it's important to normalize it. It's a human emotion that occurs when we engage in a self-evaluation and we deem ourselves to be globally flawed or deficient or unworthy about some sort of stable, enduring aspect of the self, my competence, my attractiveness, my intellect, my worthiness. Shame also often has, or some would argue always has, a component of negative judgment. So particularly of the self. And that judgment might be perceived from other people that are real around us. We perceive that they are judging us negatively. It also could be a projected person from our imagination, someone that we're imagining watching us, looking at us, seeing us, and then negatively judging, which I find fascinating. That really comes from the social, sort of sociocultural lens of shame, where it's a very social emotion. And that perception of negative judgment, either from real people or often as manifestations of our own self-judgment, is a critical part of the shame experience. Shame is a normal emotion. I'll just say too, this is one of the reasons that it's so important not to talk around it, because when we do that, we just further stigmatize what is a normal emotion that we've evolved with as humans. It's uniquely significant above other emotions. It is critically important for regulating social behaviors, for driving cooperation, for ensuring belonging. And over the course of human history in our evolution, those attributes of shame or functions of shame were critical for survival. And so they really, being shame prone, being able to feel it, and often, acting to avoid shame is what kept us in alignment with one another in community. And being in alignment in community allowed your genes to pass to the next generation, or at least facilitated that, and it also facilitated safety. Now we don't need that quite as much, although we are a very social being still, and shame still has a very active and important role in our social lives.
That's a fascinating outlook because one thing that you said earlier, and my mind got how you say something and your mind gets stuck there, was when you mentioned that it's like this imaginary experience too. Because when you said that, like this imaginary being, I instantly felt like, are you talking about the self-critic that I have in my head that is actually shaming me? And how does that fit in over there when we are also like looking at the larger social construct of how it has potentially helped us to evolve in a way where we're in safe spaces and people are behaving according to the norms per se. But when you said that, it is something like you have created. That's what came to my mind. I'm curious to hear your thoughts on that.
Yeah, I started my research from more of a cognitive psychology theoretical foundation, really looking at shame being a part of a self-evaluation. And we evaluate ourselves in light of our behaviors and standards, and then we deem ourselves to be unworthy or flawed, et cetera. And a colleague that I'm doing a lot of work with, close work with the shamelab, Luna Dolezal, she really has come from the perspective that is where shame is really ultimately a social emotion. And so working with her has opened my eyes to this notion of negative judgment is being really fundamental to the shame experience. And so I've actually been reflecting myself a lot on what that means for me, because I'm a shame-prone person. I definitely am apt to feel it, and I've come to learn about some of my own triggers. And one place that I find myself experiencing shame under this kind of concept of the imagined other is when I'm with my kids. When I am with my kids and I'm having a tough moment, I'm getting frustrated, irritated, they're driving me crazy, or I just am not showing up as my best dad self, that is one of those standards. If I'm trying to be perfect at anything, it's being a dad, and that is impossible to be perfect at. When I'm in those moments of not living up to that standard, I am actively watching myself as if a neighbor was looking out their window. It's wild. In the moment and in the after, I think about, what if a neighbor saw me lose my cool there, or saw me be dismissive or whatever it is. And there was no neighbor there. And it's in, I think as I self-analyze, I think it's my own looking at myself and my behaviors from some pseudo-objective lens that then turns into judgment. So it's a really complex phenomenon. If a neighbor was there, it would be even worse, frankly, because I can sometimes give myself a pass and say, yeah, nobody saw that, but you need to be better. You got to do better than this. So it's, I don't know. I think here's how I would couch it. I think we're inherently and remarkably self-conscious people as humans. I think we're constantly considering how others are seeing us, perceiving us, and we're constantly evaluating ourselves in the midst of that. And I don't think we talk nearly enough about that self-conscious experience.
We don't. It almost seems like it's potentially happening in a silo, only in my head, not in anybody else's head. And I'm just going through this unique lived experience where I am finding myself as the worst mom ever, or having all those. I could so relate to what you just said. Although I don't feel like a neighbor situation, but it's more of the whole society is watching. And then what would they say? I'm gearing up to throw my daughter's birthday party this weekend as we record, and I don't have all the planning prepped out yet intentionally, which was my way of helping relax my perfectionism, but it really is like still throwing me in this odd frenzy of anxiety. So it's been fascinating to watch that.
It can be really hard to negotiate with those standards when they're really deeply tied to identity. So it's easier for me to drop my standards or to be accepting of half-assed work if it isn't really critical to who I am and how I know myself. But that's where imperfection gets really tough, or falling short of standards is really tough, is when it is related to things that are really important to how we know ourselves and from where we derive our self-esteem. So that's why parenting is such a trigger for me, because I want to be a good dad, and I want to be, that's who I want to be as a person. It's one of the reasons that I feel I'm worthy as a human on the planet, is taking care of other people. So when I feel like I'm not taking good care of other people, when I perceive the neighbor in the window looking at me and thinking, God, it's a bad dad, right? That's shame. This neighbor could also say, that dad's having a tough day. His kids are being a nightmare. Right? And he's probably tired and it's cold outside and whatever. That's guilt, by the way. So guilt is when we fall short of standards, and we don't blame a flawed self. We blame something we can change, something specific, something actionable, behavioral, or even circumstantial outside of our control. But that I think shame is a particularly potent emotion when those standards deal with who we are as people and how we know ourselves.
And as you think about, now you've mentioned guilt and with shame, as well as like you made a really interesting point where the things that are important to you, such as being a father, is so important to you and how you show up in those roles, which is interesting because when I'm talking about perfectionism, it doesn't seem like perfectionism also is all encompassing. There are specific parts of my identity. For me at this point, those two things primarily are the clinical work that I do as a physician and then my role as a mother. And if I'm falling short in any domain over there, it is such a personal slight. So how do you see this interplay of shame, guilt, and perfection?
I think there's massive entwinement. And I don't think we've elucidated that very well in our literature, or in our research. And I say in terms of not only certainly medical education and medicine, but I think even more broadly, I think there's some big gaps in how we understand these self-conscious emotions and things like perfectionism writ large. Well, our work has largely focused on qualitative work with medical learners and understanding how they experience shame. And perfectionism shows up diffusely through that work. Partly because the average medical learner is a quite perfectionist organism. And in many ways, that perfectionism has led to the level of achievement that is necessary to enter the profession and then thrive in the profession. And it can be adaptive and maladaptive. And we can talk about the difference in a minute. It's notable that in the course of talking to people about their shame, their perfectionism came up over and over. It's not surprising, though, when you look at the psychology. Perfectionism, or perfection, is the ability to achieve a standard to the highest degree all the time. And shame comes about, often when we fail to reach a standard. Any sense of its form can be a shame trigger, because shame can come from falling short of a standard and then blaming that failure on a flawed self. So when we're perfectionists, we don't, it doesn't mean we're destined to experience more shame, but the risk of experiencing shame is much higher because the failures to reach standards are going to be more frequent, if that makes sense. Now, what's really interesting though, is that we find in our research that not all perfectionism leads to shame and not all perfectionism leads to bad shame. And there are definitely people in our work and in our research who are perfectionists, fail at being perfect all the time, and have adaptive, non-shame inducing, emotionally healthy responses. And when we really dig down into why that is or how that is, it what we think is differentiates it is shame versus guilt. That guilt, like I said, also comes from failure to reach a standard, but the blame or the attribution for that failure is placed on something specific, action-based, circumstantial. Okay, so this is where we think there's clear alignment with what psychology has described as adaptive and maladaptive perfectionism. So in psychology, maladaptive perfectionism is I'm a perfectionist, and when I fail to reach my perfectionist standards, I have some sort of a maladaptive response, right? I quit trying, I get angry, I get defensive, I get emotionally distressed. It's essentially a negative reaction to failures of perfection. Whereas adaptive perfectionists respond to their failures of perfection in more growth-orienting ways. They work harder, they reach out for help, they validate themselves. There's a more adaptive response. What we think may facilitate one versus the other, maybe not wholly, but in part, is shame versus guilt. If you fail to reach a standard and you blame your incompetent self on that, the natural response when you feel shame is to disengage, withdraw, protect yourself, hide, or it could be to blame others, to be defensive, to be angry, all of which would comprise that more maladaptive set of behaviors following failures of perfection. Guilt, when we feel guilt and we identify something specific that we've screwed up at, right? I'm having a bad day. I was hangry when I yelled at my kid and they were being a terror. The natural tendency, we are naturally growth oriented. We naturally want to improve our transgressions of our standards and to fix them. When we have something specific we can fix, we are naturally oriented to go about fixing it. So guilt tends to promote more reparative action, attempts to heal, attempts to repair, attempts to apologize, all of which help comprise that more adaptive response to failures of perfection. So we actually think that, and it should be studied, that shame and guilt mediate adaptive versus maladaptive responses to imperfection.
Interesting. Very interesting breakdown, the way you've shared it. There are some researchers that make this point that we should stop calling perfectionism as adaptive and maladaptive, and we should just call all of perfectionism not good. And that what you're describing as adaptive responses more so will lie in the category of like healthy striving for excellence, but in a more healthy way. I'm not a lab researcher on perfectionism, so part of this quest for getting answers and the way we label and understand things has been hearing everyone's opinions on this and what in their opinion has been. I really value how you broke down shame with guilt and the adaptive and maladaptive responses. What comes to your mind as I share this thought?
Yeah, so I think we have to be careful overly dichotomizing complex phenomenon. And we also have to be careful about saying it's an all or none phenomenon, right? It's fairly clear that within the construct that we're labeling or calling perfectionism, there are more constructive and less constructive responses to the failures that induces, right? Or that come along with that. I just don't think you can say that striving to reach high standards all the time is all bad, because there's a lot of good that comes from striving to be perfect all the time, right? It's just a matter of what do you do when you inevitably fail at that? That's what we need to be talking about. I don't think that perfectionism itself is inherently bad. What might be problematic is what happens when you fail at it, and are you prepared to fail at it? And how often over the course of, for example, an education system, do we reify the notion that perfectionism actually is possible, it should be pursued, and that when you fail, it means there's something wrong with you, or your own brain tells you that, and then we don't address that or fix that. That's where it becomes problematic to me. I think that what we're not doing enough of is recognizing the underlying emotional and identity related processes that are occurring with perfectionism. And that's, I think, where we get to some deeper understanding, and maybe we harness some of that understanding to make perfectionism work for us and try to mitigate where it doesn't work for us. The other thing that comes to mind is that, and this has been really helpful for me, it's really helpful working with learners. It gets back to my point earlier, maybe differentiating perfection from perfectionism. Perfect is an end state. It's a line in the sand, right? It's something you either achieve or you don't. And anytime we have goals that are end state oriented, that can be either yes or no, the chances that it's much easier to deem ourselves as having failed at that, right? At achieving that standard. So I think perfection as a goal is for all. Perfectionism as a striving, like you said, that's a great word. Striving to achieve perfection while recognizing that it's not possible all the time. I think that can be adaptive. But the key is you have to, how do you define failure within that paradigm? And to me, failure is about not trying. It's about not putting yourself out there. It's about not giving it your best effort. It's not about the failure to reach the perfection that you're striving for. If that makes sense. So when we orient ourselves more towards process and away from end state, it's much easier to see ourselves as achieving, as growing, as getting closer to perfection, even when we might be failing, than when it's just an all or none, yes or no type phenomenon. And that bridges over into growth and fixed mindset and other very much intertwined.
Very helpful to look at it from a space of what are you going to do if you fail? And I was also thinking of it almost that what is your intention or the act that you're striving for perfection at the end? Is the intention to hide, I guess, those complex emotions, such as I'm just trying to hide my flaws right now, and where like shame and guilt and all these things are coming up. So what is my baseline that I'm trying? Am I trying to run away from something, run towards something? And so looking at it from the intent point of view, and like you mentioned, like what do you do when you fail? You keep trying, or do you hide, or do you internalize that shame component of it?
Okay, so here's where I think this gets really interesting and even more complex, but also revelatory, is in thinking about and really deeply reflecting on why am I striving to be perfect? Okay, that is a critical, fundamental question that we don't ask enough. And this gets down to, I think, the concept of self-esteem. What makes me feel worthy? What makes me feel good enough as a person, as a med student, as a husband or a father, as someone who's worthy of being alive? As fundamental as that, right? So self-worth, what makes me feel worthy? And self-esteem being our assessment of that level of worthiness at any given moment. And there's something called our sources of self-esteem, which is from where do we derive that feeling of self-worth or the perception of self-worth? And I think in medical education, we're finding that a really key driver of shame and then a key contributor to self-esteem is performance. So how I perform, in psychology has a term for this called performance-based self-esteem, but how I perform deeply influences how I feel about myself, how worthy I feel, how good enough I feel, such that over time, when I perform at a high level, when I achieve at a high level, when I attain perfection, it makes me feel good about myself, and it makes me feel worthy. It makes me feel like I'm enough. And that relationship gets reinforced over and over. And I think in my own perfectionist tendencies, where it has been a struggle is where I'm needing perfection to feel worthy, where perfection becomes a source of self-esteem. And if not perfection, maybe at least high achievement. And that high achievement needs to be obvious. It can't just be a perceived high achievement. It needs to be like valedictorian or a certain MCAT or board score, a certain residency selection program that I get into, or some sort of prestigious marker, right? And so that's where when we think about what's driving perfection, a lot of the time I think is driven by the fact that we need it to feel good enough. And when you fail to achieve it, your self-worth is implicated, your self-esteem is implicated, such that if high performance, high achievement drives self-esteem, low performance, or even average performance can be a hit to self-esteem. And that's a precarious spot at a self-conscious level. That I'm not going to say it's an inherently bad spot, but it's precarious, especially when you're doing something like learning medicine that's just impossibly hard. And it's just absolutely lined with failure everywhere and struggle everywhere.
How do you then articulate this to learners? And we look at this medical education system, and as I've been having these conversations with trainees and early career physicians, and especially But it's been fascinating that even if I'm sitting with a department chair and we're having a conversation, shame will come up. And the only thing that gives me an odd kind of hope is that the more older physicians are not using the word shame, they're really staying away from that. I don't have shame. What are you talking about? Whereas the younger physicians who are in that training phase and they will use the word shame. In fact, I had a moment where I posted something about shame on social media and my DMs got flooded. People did not want to comment openly, but it was very interesting. Somebody said, that's it. That's what I have. That's what I've been struggling with. So how do we then help our learners create insight that they're not bad, they're not terrible, they're not failing?
Yeah, that's the heart of it, right? Because all the research in the world doesn't matter if we're not going to make impact with it and actually try to change the way we live in meaningful and healthy ways, and the ways that we teach, and the ways we support, and the ways we struggle. I think I agree that shame is an easier thing for many people to talk about. It generationally, I do think there's a lot more openness, not only to shame, but also just to the unique messiness of human life, being more open about it. For one, I think we just, again, can't talk around it. I've had so many people say the exact same thing as you, that this is the first time I've ever really understood what I was feeling, or I see myself in that illustration you just put there. That is my life. And I've never seen it like that before. So I think just opening forums around the emotion and creating some shared understanding and making it an acceptable and real thing is number one. At the same time, we also, going around and trying to talk about shame all the time and everywhere is not going to be the most effective approach either. And we have to do that conscientiously. I have a lot of ways I do this. I just say that the average medical learner, first of all, I understand some of the self-conscious milieu that they're living within. And so I try to get out ahead of some of that. We're all oriented to performance because much of medical learning feels like a performance. In reality, learning and performing are antithetical to one another. You cannot be performing and learning at the same time. So one of the big shifts that I have come across that I find really helpful is I'll tell learners when they first start working with me, you're here today, you're not performing for me or anybody, you're here to rehearse. And when you rehearse, you can make mistakes, you can fall on your face, you can get things wrong. But like any good rehearsal, I expect you to use that failure or that struggle to make the next rehearsal better and the next rehearsal better. And so what I've been trying to do is shift them away from the idea of performance and needing to prove themselves worthy or something in some way, and really shift them more towards the work that goes into ultimately being able to perform. And that work, we often don't focus on the work itself. We just focus on the outcome. And we all want to be good at things right away. It sucks to link something so deeply to your identity, like being a doctor and helping people and making a difference, to the years of sucking at it that you have to endure. So you're like, this is what I'm devoting my life to in a lot of ways, and where I derive self-worth. And I have to be bad at it for a long time to be able to get good at it. Like, we don't talk about that struggle enough. We don't. And when we don't talk about that struggle, we actually dehumanize ourselves, for one. And we create these very unrealistic notions of what it means to learn something really hard. And then we also don't give ourselves the grace to struggle at something without feeling like we're the problem.
I loved how you said that we have to be bad at something to be good at it in the long term. The focus that I feel personally, as well as other physicians and clinicians that I have interacted with, is I have to be bad at it, but I have to appear that I'm great at it the whole time. And you mentioned dehumanizing, but also what are we doing here? This entire narrative. So I love that you're offering this is a rehearsal and we're going to rehearse and rehearse. But I also feel like that's a position I find myself as what also like society as large expects. The buck stops with the physician. Somebody was not okay on the front desk, but when your patient score rating is going to come, it's going to impact you. Everything, all the dings were, and I know I'm jumping from learner to actual roles, but it's almost to the outside observer that between healthcare leadership and actual clinicians working in the trenches, it's plain. The field is completely plain and equal. And the patient at the end of the tunnel is expecting flawlessness across the board. And when there is something wrong, the person to always take the easiest hit is the physician, is member of the clinician team. And that's where we're heading. That's the outcome. So as a learner, I see my attendings, that's what's happening to them. I'm also not supposed to really say anything to them that I am actually struggling and I need to appear flawless this whole time.
Okay, yeah. So I think what you just laid out, what comes to mind for me, the term that is really overwhelming and comes to mind is ideology. We live within a set of often implicit, unspoken beliefs about how we're supposed to be. And not only how we're supposed to be, but how people are judging us or seeing us. And those beliefs have just come to exist and be largely accepted as normal to the extent that we don't even challenge them. I'm going to maybe for the sake of argument, if not to be a little bit evocative, I actually think patients have no problem with us not being flawless. Now, not all patients. If I would prefer when you're operating on me or my loved ones that you're pretty flawless at that time. I might be more forgiving of your flaws when it's not me who might be the negative recipient of them. But I actually think it would go a long way in humanizing our healthcare systems and actually providing better patient care if we allowed our patients to see that we're not flawless people. We're not flawless thinkers or flawless proceduralists. We're actually superhuman just like they are. Because I think this ideology that we are flawless, that we can be flawless, and that we need to appear flawless has gotten us in all sorts of trouble with our mental health. Actually, I think it's largely at the root of a lot of it. Because what that ultimately is that's fundamentally dehumanizing. It's dehumanizing because it is not humanly possible to be flawless. And really, if think about the internal discord and distress of knowing that you're not flawless and then feeling the pressure to appear like you are. And like that, the identity dissociation or tension that can come from that. And then that's where shame lies a lot of the time, right? Is that saying, damn it, I should be able to be flawless. Look, everybody else is projecting it. You don't know that behind those projections are also people who are very insecure, who are very flawed people who struggle just like you. All you're seeing is the veneer that our ideology says is necessary. And you're thinking that's real. And when learners are come into that reality, that's what they see. And there is no counter narrative that says that it's not real. And so that becomes the standard. It becomes the norm and the ideology is reified. And then before we know it, we're all working in these like smoke and mirrors bullshit of flawless healthcare professionals. That is ridiculous. And we all know it's ridiculous. And I think knowing it's ridiculous and not being able to call it that and then change it is burning us out. I think it's one of the things that makes us feel like cogs in a wheel, right? Because it's not authentic. Anyway, that was a soapbox moment, but that we are living in these ridiculous paradoxes in the work we do. And I don't think we're doing a very good job of explicitly acknowledging those and calling them out and then examining them.
I just have such relief hearing all of what you just said. Because I agree to your earlier point that you said that our patients are fine with it. And the reason I'll say is that it's personal lived experience. When I started communicating with my patients when I was practicing full-time as a primary care physician, my limitations, this is the time that I get, and this is what I'm supposed to accomplish from seeing you, from like the medical assistant taking your vitals, me doing everything I'm supposed to do, refilling your meds, reviewing your labs, finishing the charts, helping you with that peer-to-peer, filling your FMLA paperwork. So when I just spit all of that out, it was like mind blown. And why was I spending all this time? This was part of my larger project to set boundaries with my patients. And I said, how am I going to be able to set time boundaries and invite them to actually show up to their appointments on time? Because I was going home at 9 p.m. and coming back at 6 a.m. again. So I just started sharing how flawed I was with them and working within the confines also of an extremely flawed system and what was expected of me. And you know what? I got so much. Oh, I understand. And also, wow, I can't believe that's what you have to do. Now, I know that a lot of my colleagues wouldn't take that time. And it's not, again, a slight to them. Every one of us is living our own odd, exhausted journeys. And the word that comes up for me, in addition to showing our humanness, is the fact that communication. Why are we not talking about this. And when we throw words like shame and vulnerability, people get so uncomfortable because they feel that they have to, like you mentioned earlier, always be in that spiral and share things that are actually, if you are trying to be vulnerable just because an Instagram post is telling you to be vulnerable and you're doing it in an inauthentic manner, that also doesn't help.
Yeah, just have a lot of thoughts as you're talking. I think it's inherently difficult for many, if not most, physicians to be vulnerable in general. I think there are ways that it is easier, and it maybe peer to peer or within really safe, protected spaces. But one place that vulnerability I think is really rare from physicians is with patients, and I think it's just because there is this prevailing notion, and that is somewhat valid, I will say, that we shouldn't show our vulnerability to our patients, that we shouldn't allow them to see our weak moments, to see our emotions, to see the things we struggle, to see our mistakes, our bad days. And I think that's just such a deeply entrenched ideology that we don't ever take a moment to say, is that really necessary? Is it? What would happen if we showed more vulnerability? What would actually happen? And I can tell you when I've done that with my patients, either because I chose to or because I couldn't help but do it, either because I was having a terrible day or I was sick or I was really struggling with an element of their care or I had to apologize to them for something. 99.8% of the time I've been met with compassion and I've been cared for by my patients. And that is an unbelievable feeling, to be cared for by the people that you care so much about. And I think that first of all, I don't think we give ourselves that opportunity enough to be cared for by other people. And I think it's because we think we need to be stoic and we can't provide the care that people need from us if we're weak or vulnerable, et cetera. But in reality, we're just as human as anybody else. We need to feel cared for and we need to feel respected. And patients, God, I've had patients, it's not common, but I've had patients hug me and say, I'm thinking about you. Or they'll say, I noticed that you sent me a message on my chart at Saturday night at 11:30. Please don't do that if you don't want to. You got to take care of yourself. They're looking out for me. That makes me feel connected to them. It makes me feel humanized in the work that I do. It doesn't mean I'm going to just pour my soul out to every patient. That's not professional. And I don't do that. But to feel like it's at least okay to be on my authentic human self in these really complex, hard places that we work is actually very refreshing. And it, in the midst of burnout and a lot of detachment at times from the work of healing and all that, it's one of the ways that really keeps me the most grounded. We need to begin more explicitly, maybe courageously and collectively examining some of the beliefs and norms and ideologies that we've just come to accept without any examination. I think we've really got to look at them and say, is this how it has to be? And if you're going to do it for anybody, do it for your learners or the people that are coming behind you, because we can create a different set of ideologies for them, if nobody.
And it definitely is going to take a lot of courage, as you mentioned. This has been so insightful. If you had to just step away and look at shame itself as an emotion, and you look at all high achievers and high performers, not just learners, what would you say would be an antidote? I know we've talked about a lot of really good things here, but if you were to say it, this is what I think right now is an antidote for high achievers at large, and then for those in medicine.
I've thought about this notion of an antidote to shame. To me, shame is not necessarily something we need to neutralize entirely. I think we do need to neutralize negative shaming, inducing shame. I think we need to neutralize shame that really shouldn't or doesn't need to be there. But when I think more about what do we do about this emotion as it relates to achievement and all those things as well, is that we just have to engage. That if there's an antidote to shame, it's to actually attend to our shame. That's the antidote, is to actually allow it to breathe, to allow it to exist, to be curious about it, to be self-compassionate throughout that curiosity, and then to process it and move through it, as opposed to neutralizing and moving away from it. To me, that's the step that we need to take at large. And I think we then need to take that step in the various realms in which it's active. And one of those realms is around achievement. We need to examine, like, why is it that we have such a drive to achieve? What is our relationship with achievement and identity? Engaging with shame is the antidote, if you will, but it's a real active process. I think with high achievers, I think the answer is not that we strive for less achievement or we lower our standards. That I talk a lot with medical learners about establishing some foundation of what's good enough for you. And we talk a lot about striving to be good enough. And there's a real tension there. They're like, I don't like that idea. My patients don't want me to just be good enough. They want me to be great. And I think that's okay. I think striving for greatness while accepting good enough is what we're after. And not just in terms of accepting the achievement of good enough, but being okay with good enough to the extent that it doesn't cause us to feel badly about ourselves. So how can I unlink my performance and self-worth, my achievement and self-worth enough that when I inevitably fail to achieve at a high level or achieve perfection, my self-worth isn't taking an active hit. And I think that we do that by shifting to a focus on growth and improvement and maybe coming closer to some high standard, maybe reaching it sometimes, but recognizing and acknowledging that we're not going to reach it all the time. And that it's the striving, it's the work where there's valor, that's really what it means to be, to achieve. Yeah, that's to me, that's what healthy achievement is, being willing to constantly do the work, knowing that you're going to fail. And the man in the arena quote is so good for this. It's the credit belongs to the man who's actually, or the woman or the person who's in the arena, marred by blood and sweat and tears, and not to the person in the stands, essentially, who doesn't know the valor of failure and defeat. Being in the arena is achievement.
I just had to vigorously shake my head right now as you said that, because it was exactly what I was thinking, that we're all in the arena and really that's what matters. I also want to echo and thank you for allowing the high achievers to take a deep breath, that you're not telling them that they have to fix all of this, fix their shame, because I feel like that's also a lot of the narratives that are being perpetuated, as if you are inherently broken, something's wrong with you. If you are somebody suffering with perfectionism, wherever you want to call it, whatever spectrum of adaptive or maladaptive, or if you are having shame, whatever you're having, you use the word allowing it to breathe and being present with it, talking about it and being willing to feel. It might sound not very like, here's the 3 tips, tricks, and hacks that you can do, but also that is really the honest relief that we should all be talking about.
Well, you know what it fundamentally is? It's just, as cheesy as it sounds, it's just allowing yourself to be a human. It's just, I find I read a lot of books to my kids right now. They're 5 and 6, about outer space, the moon, the sun, like the planets, the Milky Way. Like, it is so refreshing to get outside of my own immediacy of my surroundings and realize what an absolute mind-blowing miracle or bit of random happenstance that we just exist at all here. Think about that. I don't think our worlds get so complicated and so small in so many ways that we lose sight of the fact that we are upright beings with beating hearts walking around on a planet circling a bigger star. It's just nuts. It's crazy. And so by taking that deep breath and saying, yeah, you're feeling shame or you're struggling here, you're not living up to your standards or something, that deep breath is part of acknowledging that you exist as an upright being on a planet circling a star. And that there's something just amazing and awesome about that. And that is in and of itself something that makes you worthy. And that, I find that helpful. I find it also entirely overwhelming, just because it makes me then look back around me and say, what are we doing? But that's for another day. I think just to get back in touch with our humanity is really a critical part of striving for high achievement.
Tapping into that awe moment as you've described. And on this extremely inspiring note, I'm going to conclude our conversation. This has been phenomenal. Thank you so much for all the incredible work that you've been doing. I'm going to put in the links for everything with the shamelab. Are there anything that you want like our audience to know, any places that you encourage learners or people who are just curious to find out more to go and visit?
Yeah, thanks for the opportunity to do that. We're doing a lot of work to try and make shame as 3-dimensional, accessible, real as we can. And so if you go to the shamelab.org or shamespace.com, you'll find a collection of graphic medicine comics we put together. We co-produced a podcast with the amazing Nocturnists out of San Francisco. It's a storytelling organization, 10-episode series of featuring clinicians from healthcare who share their experiences of shame. And it is a deep dive, and it's really emotive, and just the production value is amazing. I can't recommend that highly enough. And then start talking about this yourself. Just see how it feels and find a person that is willing to sit and listen to you and then tell you about their experiences. And I think that's really where all this starts. So thank you so much for having me. Amazing conversation. And it's really been a pleasure.
Thank you so much. This episode is part of a special series and my budding book project on unmasking perfectionism. Thanks so much for spending time with me today. Just a quick reminder, while I am a physician, I'm not your physician, and nothing in this podcast is medical advice or any kind of professional advice. Everything shared here is based on my personal experiences, and the views expressed are entirely my own. If you enjoyed today's episode, I would love for you to rate, review, subscribe, and share the show with anyone who might need a little inspiration to redefine their own version of success. I'll see you next time. Until then, keep reimagining success one small step at a time.